The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. We're just going to give everyone a moment to join, and we'll get started. Good afternoon, everyone. Welcome to today's webinar, and thank you for joining us. My name is Dr. Emily Durender, and I am the Chief Scientific Officer at Metabologics. And today's webinar is actually co-hosted by the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health in Austin and Live Smart Texas. I'm the co-chair of Live Smart Texas, and the center's vision is for healthy children in a healthy world. And the Live Smart Texas Coalition believes that collaborations can achieve better health outcomes than individual entities working in their own in silos. So before we get started, I just wanted to make some housekeeping announcements. First, this webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. The direct link will be sent to all attendees later this afternoon. Second, if you have any questions during the presentation, please go ahead and just put them right in the chat box, and we will have a good amount of time at the end for a guided Q&A at the end of the session today. So I'm excited to announce our speakers today. We have Dr. Melanie Hingle and Mr. Michael Lopez. So Dr. Melanie Hingle is a nutrition scientist, a public health researcher, and a registered nutritionist at the University of Arizona in Tucson. She works at the intersection of nutritional sciences research and public health practice, where she studies predictors and consequences of behavioral risk factors that are associated with obesity and type 2 diabetes. She is the former chair of the Obesity Society's Electronic and Mobile Health section, and she also has contributed to the International Society for Behavioral Nutrition and Physical Activities Special Interest Group in Electronic and Mobile Health. So this is definitely her area of expertise. And then Mr. Mike Lopez, he joined the Texas A&M AgriLife Extension Services Family and Community Health Unit in 2011. He supports the development, the implementation, and the evaluation of extension education programs related to planning for active communities, electronic and mobile health technologies, physical activity, and walking efforts. Mike's educational background includes a bachelor's degree in biomedical sciences and a Master of Urban Planning degree with a concentration in active living in healthy communities, both coming from Texas A&M University. I will now hand it over to Dr. Hingle and Mr. Foster to start the presentations on effective technology for promoting healthy lifestyles during COVID-19. Dr. Hingle?
Thank you so much, Dr. Durandar. I appreciate the invitation to be here today. Thanks also to UT School of Public Health and Live Smart Texas. All right, this is one of my favorite things to do, and I have to say I don't have enough opportunities to talk about science these days, so I really definitely appreciate the invite today. Hello from Tucson. You guys can't see me. My webinar or my webcam is not working very well, so I apologize for that. There's snafu that happens with technology presentations, so this is totally par for the course, just to let you all know. You can Google me if you want to see what I look like. And again, thanks for being here. So our topic today, I'm going to jump right in. We don't have a lot of time together, and I want to make sure to leave time for Mike's presentation. He's from your great state, currently in your great state of Texas, and will give you the practical recommendations that go along with kind of my more general guidelines today. And so what we want to accomplish today is to help you, the educators and health professionals and students out there, understand how to find effective technology-based tools to promote healthy lifestyles, especially important right now, always important, and especially important right now. So let's see if I can advance these slides. There we go. Okay, so our conversation today, the next 40 minutes or so, we're going to discuss the landscape, very broadly, the landscape of technology-based tools that are available to support healthy lifestyle behaviors and help you decide what to look for when you're choosing a program. And we want you to be successful in navigating. There is a huge marketplace out there of apps, and also increasingly of remote programs, given our pivot to Zoom and other online platforms in March, that are all intended to promote healthy lifestyles, and the extent to which they do is up for some discussion today. And I am not going to focus as much on this last part. That's going to be more Mike's area, talking about what makes implementation successful, and he might give an example or two of how to overcome what we know will be inevitable challenges in adopting a new program or technology. So I want to begin with maybe working a little bit backward and talking about healthy lifestyles, just reiterating why we're here today. Sadly, as we know now, over the last 8 or 9 months, data have accumulated that indicate that individuals with obesity are at much greater risk of poor outcomes from COVID-19. And you can see here, this was a meta-analysis that was assembled a couple months ago, looking at folks with obesity and who contracted the SARS-CoV-2 virus and their likelihood of ending up in the hospital, admitted to an ICU, and death. And it's much higher than folks with a healthy weight. So really a constellation of physiological and social factors are the drivers of these very grim statistics. We know a lot more about, this is actually Dr. Durandar's specialty, the biology of obesity, biobehavioral aspects of it. And we know there's impaired immunity and chronic inflammation that goes with this condition that can all worsen COVID-19. Obesity is a stigmatized disease, and so people with obesity may avoid medical care. There's a lot of other things that go along with that is not within the scope of this presentation, but simply making the point that it's a tremendous challenge, and especially for folks with obesity. My area of work in general covers the modifiable risk factors for obesity and chronic illness. We know from lots of accumulated data, again, over the years, from big cohort studies, that in the United States, deaths and disability are largely attributable to behaviors, to lifestyle behaviors. And leading risk factors are the kinds of things that I work on a daily basis in my research program and outreach programs, including dietary risks, high body mass index, high blood pressure, high fasting plasma glucose. The good news is you can do things about each of these risk factors. The bad news is that it is challenging, and something that we all work at every day. So when you're choosing a program, and I'm going to be very broad here because when I say technology, or even use the word digital or electronic health or mobile health, just think very broadly about a program. It could be an app, it could be a website, it could be even a telemedicine program would fall under that kind of general category, a remotely delivered program. What are the considerations when choosing a program? And again, thinking somewhat generically and broadly, because I want to help everybody on the call, and I'm not sure where you're coming from in your own practice and context. So these are the questions that we always advise people to consider when they're choosing a program to impact on health. I'll talk about each one in turn. Very important, will people use the program to improve their health? This is super important. Obviously, if you build it, will they come, right? Kind of answers that question. And in the context of a research project, we always talk about this in terms of acceptability. Is it acceptable to people? Is it feasible to deliver? And how easy is it to use? So talking a little bit more about that, will people use it to improve their health? This is really the primary considerations here. So people have to be motivated, obviously, to want the program or app, and there's different ways of influencing that and making it easier for people to access. Folks must be able to afford the program and the connected device that usually goes with it. So that could be a smartphone, a computer, a tablet. It is still an access problem for a lot of people here in the United States, depending on where they live and their socioeconomic status. So a lot of people who are lower income, for instance, do connect to the internet through a smartphone. They don't have a home computer, not necessarily a tablet, but they do have a wireless enabled device. Once an app or program is acquired and installed, people need to remember to use it, wear it, update it, recharge it, all the things that go with a wearable device or an invisible device, an app, or even a web program. They need to have the ability to keep up with it. It must, obviously, this kind of goes without saying, or perhaps not, must be able to track the targeted behaviors, and assuming the information is collected with some accuracy, the data must be presented back to the user in a way that they can understand it, that motivates action, sustains that motivation toward improved health. The other consideration, another very important one, will its use result in measurable behavior change? This is what we call efficacy. We're testing it in a randomized controlled trial or otherwise experimental condition. There's a lot of different ways of thinking about this. This is a framework developed by Susan McGee in the UK, which she calls the behavior change wheel. COM-B is the acronym she uses to stand for capability, opportunity, motivation, all of the things that lead to behavior change, and that behavior change only occurs as an interaction between these three necessary preconditions that have to be around. This is not the be-all end-all of frameworks, but it's something that helps me think about and explain the kind of determinants, the foundation that needs to be in place for measurable behavior change to happen. When you're deciding how to select a program, it's also important to think about the components that are associated with increased effectiveness in, I'm going to use diet and physical activity interventions as the example, because that's what I do. And so we know from the literature that the recommendations for producing measurable and also importantly, clinically meaningful behavior change use these very well-defined established behavior change techniques. This is the list here, some of them. So goal setting, these probably sound familiar to you. Self-monitoring, role modeling, social support. Social support is very important. And so engaging social support of others to support the patient or person you're educating is critically important for them to be able to sustain change that you're encouraging. And in the case of physical activity and diet, these go together really well. So targeting both is better than one or the other. Another consideration when choosing a program, will it result in clinically significant improvement in health outcomes? Super important as well. And this is the effectiveness outcome that we're looking for in a trial. Of the populations I work with a lot, families and children. This is an example of a meta-analysis. Again, you can, when you're doing your own review of the literature, you can look for meta-analyses or systematic reviews that summarize all the literature in an area. And this one has to do with weight loss interventions for children with overweight. And looking across 61 trials, we know, or we observed that combined lifestyle interventions, those that target families, not just children, are the most successful in helping children change their trajectory of weight, of excess weight. So it is really important to understand what approach, who should be involved, what the literature says. And finally, does it work in the real world? Also very, very important. You can do all this great work, identify the best program, and then it falls flat. One way to think about this is through the social ecological model. This is an adapted version of it. So when you're thinking about translating guidelines into community health promotion activities, these are all the considerations, because behavior change does not happen in a vacuum. It happens in context. It happens in social contexts, physical environments that support or don't support, and there's a whole policy overlay that can help drive certain behaviors as well and support them or not, or counter them. So thinking about always, when you're selecting a program, what is the context within the program is within which the program is unfolding? And critically, basic security must be security, housing security, financial security, or wellness. And these are considered among the so-called social determinants of health, which are acknowledged now quite widely in healthcare settings and also in research with folks who are lower income. So I'm really pleased to see this is getting critical attention. I think that things like food insecurity, housing insecurity, financial insecurity really impact people's ability to act on the recommendations we give them. So I talked a little bit about healthy lifestyles and even generically selecting a program. I want to dive a little bit more specifically into software applications. I'm not going to focus as much on remote programs. There are some good emerging examples of remote programs. Mike's going to give you one. And I'll touch a little bit on the landscape of technology-based tools before I turn it over to Mike. So when you're going to look for apps, of course, you fire up your App Store app or something similar on your smartphone or tablet. This is just an example. So looking, I'm gonna use MyFitnessPal as an example, not because I think it's the best app or even one of the top, but just it's an easy thing to discuss. It's free. A lot of people use it. So firing up the App Store, you get a lot of, if you're going to look for something, you get a lot of results, right? And literally over 325,000 apps that are focused on health right now. If you're going to get into the App Store, that is an awful lot. How do you make sense of that? How do you recommend things with that many choices? There's a couple of ways. Of course, you don't want to end up with an app that is not efficacious, that does not have any kind of evidence behind it. It's just a shiny thing that tells people what they want to hear, or doesn't do anything for them. So this is what we're trying to avoid. And there's some structure that I'm going to give you, some guidelines to help. Luckily, the WHO also agrees that digital interventions for health is important, and there should be equity across these different technologies with regard to people's access. The evidence is important. So the Director General of the World Health Organization released a report that is recommendations on digital interventions you can check out. And I think that really outlined this key challenge very specifically and simply. And that is just, we're here to make sure this gets to people who needs it. Should not become another reason people are left behind, or another way of increasing the division between people that have access to health and benefits from it and people who do not. So evidence is important. Okay, we're going to do the quickest tour ever of commercial health promotion and weight loss apps that are out there, the landscape. And again, I'm being very broad here and not at all specific to particular kinds, but looking across some reviews that have happened. These have been done by some of my colleagues here in the US. And looking at content of the commercial apps that are available, really this is a cautionary tale. And you can see from the quotes from these different articles and systematic reviews that a majority of the apps, think of those 325,000 out there, lack expert recommendations. In general, they lack theoretical content, which is, is there a reason that we should believe that this should work to begin with? What is the foundation for this app and this content? There's insufficient evidence-informed content. So once we've done the research, that doesn't make its way into the app or into the program very often. And maybe most depressing of all, apps with the most evidence-based strategies, or with more evidence-based strategies as part of them, are the least popular. So, probably because they've been built by researchers like us and not companies who know what they're doing. I'm a big fan of a partnership, industry academic partnerships, and in overcoming that particular challenge. But this is what we have to deal with in general. Again, very, very broad. So with that backdrop, I'm going to leave you with some things to look for, because I think this is very specific, and you as folks enabling health can have this in the back of your mind if people ask you, what is the best digital app or program to promote health behavior change? You will get this question if you haven't already. My answers are partially here. Of course, they have to be all the things we already talked about. Accessible, meet people where they are. They have to be engaging. They have to be functional. They have to be aesthetically appealing. And certainly they have to be credible. A few years ago, there is a paper that was published from this group here, you can see, and they developed a tool for assessing the quality of mobile health apps. This would also apply to programs to some extent, to remote programs, not just apps themselves, but it is specific to the apps. So this is helpful though, because before, there's no regulation. It's kind of the Wild West out there, right? Like just like with dietary supplements, lots of apps popping out into the market. They make some pretty good claims, and not all of them are holding water in the way that we would hope. So this MARS, it's called MARS, the Mobile App Rating Scale checklist, has information criterion that you go down the list and make sure these things are present, score them, and they have some subjective criterion that I will also share with you before I conclude today. So the information, we'll go through each of these. I'm going to give the example again, going back to that app store, diving in. MyFitnessPal is the one I'm going to use just from an example standpoint, again, not endorsing, but because a lot of people do use this app. So going through the checklist, accuracy of app description. Does the app contain what it is described? There's always a description in your app store when you're first looking at apps and opening, and you can even go to this once you've installed it, of what this app does. And so it is important that the app does contain what is described. Just like a dietary supplement bottle, you want what's in the bottle to match what's on the label. So make sure you look at that. It's not, you can kind of give it the sniff test, and if it says stuff that's too outrageous, maybe buyer beware on that one, or caution is warranted. MyFitnessPal's description is here, you can read it. Does the app have specific measurable and achievable goals? You've already heard me mention this as a really important prerequisite for successful health behavior change, clinically significant health behavior change. So in the case of, again, the example of MyFitnessPal, you can look for these things and what is the targets that the app is promoting. In this case, MyFitnessPal is physical activity and diet, so it's very specific. They do help you set goals based on your personal desire to lose weight or maintain weight, exercise you want to complete, etc. The quality of the information is really important. Is the app content correct, well written, and relevant to the goal topic of the app? So again, the kind of education the app presents or the program presents is really important, to not be misinformation. There's a lot of myths out there regarding weight management and nutrition and physical activity and what's the best. And so again, as health professionals, your patients and your students will be looking to you to help guide them. Regarding quantity of information, is the information presented within the scope of the app? Is it comprehensive but concise? That's a tough one. This is a balancing act there, of course. Some of that is sort of arbitrary and subjective, but you've probably seen enough of these now to know if something is overwhelming amount of information or if it's arranged in a way that's user-friendly and easy to understand. Is the visual explanation of concepts, the charts, the graphs, the videos, clear, logical, and correct? Here's an example again. You can see that things are broken down in a different way. There's trends. This goes with, again, like things like self-monitoring, which is an established behavior change technique. Goal setting is usually part of apps, should be part of apps to help people set goals that are measurable and achievable and all those things. And so they should be presented in a way that makes sense. In the case of, again, weight management, you want to make sure that whatever the app is suggesting, it's not suggesting something like extreme weight loss, or it does caution people if they're putting in something that is maybe unrealistic. And then credibility is important as well. Does the app come from a legitimate source? Has it been trialed or tested? and this can be verified by published evidence from the literature. And so here's an example of a manuscript or a publication that used MyFitnessPal. It compared some things. It's from a few years ago, but you can find these things in the literature. That's a good thing. That means that they're letting it be scrutinized, hopefully by an independent source, and putting the data out there for people to see. Finally, this is not on the checklist, but it's very important: data safeguarding and privacy. And you want to make sure whatever you're choosing has very explicit terms of use. There's an agreement, there's a policy. Often people will scroll through these like crazy, like really fast to get through it. And I caution folks not to do that, because it is your data. Your data is valuable, and you want to make sure people aren't selling it. If you're sharing it with one app, is there reciprocity with another program that they might be sharing with? Again, you're in charge of your data, so you give it permission or not. But just to be an informed consumer about this, because it is relevant, especially these days, with just all the health information that's out there. And then finally, subjective quality. I really like this, because I actually think this might be more valuable almost than the objective or than the measurable ones. Quite simply, would you recommend this program to people who might benefit from it? A lot of the times I'll hear practitioners or professionals who'll say, oh, you should do this app, but they have never tried it themselves. So actually I would recommend you try some things that you might recommend, just so that you know what the experience is like. How many times do you think you would use this app in the next 12 months if it was relevant to you? Would you pay for it? What is your overall star rating? Which is, I think, a really good subjective criteria. And is it one of the worst or one of the best? So in summary, I'm going to turn it over to Mike here. There are hundreds of thousands of apps for that, whatever that is in your mind. In my world, it usually is nutrition, physical activity, weight management. Some of these programs and apps are great, and many are not. And really the same rules of engagement apply to mobile apps and digital remote programs as face-to-face approaches. So they're not different. They're different in delivery, certainly different in structure. But if the SNP test applies to the face-to-face, it should be built on evidence. It should be credible, measurable behavior change, clinically significant outcomes, all the things I mentioned. And rest assured, there's no best app. And you can serve, I think, in your role as the guide on the side. So if someone asks you if there's the best app, just reassure them, not really. It's one that works for you. It's like a diet. It's one that works for you. And help them to provide the additional scrutiny, kind of level of scrutiny of the existing tools that maybe they cannot do themselves. They just need another person to talk it over. All right, so I hope that was helpful. You can find me, again, as I mentioned, in Tucson, the University of Arizona, and I'm going to turn it over to my colleague, Mike.
Awesome, thank you so much. Can you hear me okay just before you turn off your microphone? I think you might have already, but can you hear me?
Yes.
Awesome,
yes.
Perfect. Thank you first for the warm introduction, as well as the invitation to speak today. I'm really excited about this opportunity, as well as really excited to co-present with Dr. Hingle. We've collaborated and co-authored in the past, and so it was great to have an opportunity to visit with everyone today and co-present along with her. And so I'd like to also extend a warm welcome to all of those attendees who are joining in for the live session. I look forward to an interactive dialogue once we wrap up this portion. And for those who are watching the recorded session, I hope you find this information helpful. But if we could go ahead and go on to the next slide, just a little bit of context, which might be helpful, especially if you look at my name and title and see planner by education. Part of my role within Texas A&M AgriLife Extension is to support multi-level intervention. So as we're talking about programs across the social ecological model, certainly a lot of face-to-face and community-based policy efforts, etc. But one of my main programmatic roles with AgriLife Extension is to provide leadership over our online team-based physical activity programs, which is really going to be the context of my portion of the presentation. So I think Dr. Hingle's presentation was a perfect, absolute perfect primer for diving into the goal for the next 12, 13 minutes now, and then hopefully the dialogue as well. And so many of us are probably joining from Texas and a variety of different positions. So whether you're a health service provider, a public health practitioner, student, etc. Within Texas, you may be familiar with AgriLife Extension. For those who are coming from out of state, you may be familiar with the Cooperative Extension Network. And so just a brief quote, which I think kind of leads into the second half portion, is from Everett Rogers in 1963 about the main purpose of cooperative extension, which is to change human behavior by teaching people how to apply the results of scientific research. So thinking of the previous 15, 20 minutes talking about that scientific research, that base for translating programs into practice is really the main purpose. And today, within the Family and Community Health Unit, which is where I'm housed, the agency as a whole, as well as the whole Cooperative Extension Network, our goal is to help people better their lives through educational programs across individuals, families, and communities. And so if the name Everett Rogers sounds familiar, also the developer of the diffusion of innovation theory, which I think is a timely anecdote for our goal today. But what we're going to cover is we're going to look through and explore our practical application of the scientific research to the creation of our Howdy Health website and program offerings that we have listed within the Howdy Health website. We're also going to go through a little context. So we are going to go through a little practical application of a discussion around how our agency and some best practices to describe and discuss the recruitment to our various online programs, as well as highlight some program activities that we offer to either supplement or enhance the online program. And then we're going to wrap up with sharing some opportunities, lesson learned, and one thing not included in here, we're also going to talk a little bit about impact. And so kind of the one portion of effectiveness, exploring measurable outcomes with using our website as a case study, but with any program or technology-based tool that you're thinking about implementing, what are some things you might want to look for using some examples from our case study. So if we could go ahead and navigate to the next slide. Just so the website link is up here on the top right to Howdy Health. Howdy Health is our centralized website and database for family and community health programs. And so we launched this platform in September 2018 to allow participants to select from a menu of various program offerings. And so each unique program design uses a theoretical approach to target key health-related behaviors. So as Dr. Hingle was talking about, what are some of those key theoretical components to look for, as well as kind of in the content analysis of commercial apps, the lack of theory at times with some of those commercial apps. That was an approach that we took specifically to ensure that we're targeting kind of our key health-related behaviors that we're focusing on. And so in total, since 2018, we've reached over 100,000 program participants. And this online centralized platform allows for registration for various programs, individualized participant monitoring and data collection, and then very timely, or very relevant rather, for practitioners and perhaps health service providers, is the evaluation component. So we have an on-demand report system and a full service help desk ticket system to help with, as you're talking about launching online programs, one thing that may be overlooked is addressing some of the technical barriers that might come along with implementing those programs in practice, as well as having a support staff to be able to handle those full service questions, especially as they're related to technical issues. So our team is consisted of FCH, which is our Family and Community Health Unit faculty and staff, that provide leadership for the design and management of the website and the programs, as well as the database. So if we could go on to the next slide here, we'll look at our various program offerings, specifically related to physical activity, just because that's the context of my background and the support that I provide. And so the objective for many of these programs was to simplify and modernize our existing either online programs or face-to-face to online formats. And so we also wanted to, it was a big goal of ours in the development, was to have a central location. I've said that a couple of times, that a user or a participant could engage in multiple programs under one account. And so as you're talking about looking at the effectiveness and the outcomes of programs, to have one account, one location, to look at evaluations longitudinally was something that we were very interested in. And so as I mentioned, I help support our team-based physical activity programs, which on our far left here on the screen, you see two logos. Those are our adult team-based programs. Walk Across Texas Adult, which is an 8-week program, and then the Walk Through Texas History program, which is a 4-week program, which uses kind of an educational hitch as one of the motivational factors outside of monitoring physical activity. And then we also have a youth-focused program intended for youth teams, but it does allow for family teams as well. And so that's an 8-week program. And then we do have 2 individual programs targeted towards one, the Live 100 Challenge, which is actually a collaboration with an outside group, which is a 100-day challenge designed to increase physical activity. And then the 10,000 Change program, which is a challenge designed to navigate an individual through 4 stages in 100 days to hopefully leave the program with an independent and sustainable healthy lifestyle. So if we could go ahead and go to the next slide, which is really the meat of the conversation around implementation. And so again, after the development of these programs using a scientific and theoretical approach, getting into the implementation, getting into some practice strategies to help recruit participants to our online programs, which I hope could be adapted to your online programs as well. And one of our greatest success that I continuously remind our network of agents located all across the state of Texas is we have professional educators across the state that facilitate the implementation of the program. That helps those locally sponsored events help put a face to the program, as well as an individual or educator who's leading that, who could also help enhance the programmatic design, as I call it, the structure of the program, but help enhance the online. So if you are coming from another state, again, you may have a network of, they may not be called agents in your state, they may be called educators, but that might be a network or a group that could be tapped into for the facilitation of programs. But we can't do everything ourselves. And so one of the great things about the recruitment, especially to online programs over the past couple of months, have been strategic partnerships. One thing that I'm very interested in is the patient to participant pathway, which is working with health service providers on helping health service providers navigate patients to program efforts locally, especially that address risk factors towards perhaps help address a clinical diagnosis or concern from the provider. And so that's one opportunity, and that's one strategic partnership that we work and collaborate. And that's one thing that I'm very interested in learning about, is how to help that pathway and help educate health service providers on these opportunities locally. Schools are always a great partner, especially with our youth-based program, regardless of the format with where schools are now, whether it be online, in-person, hybrid, and whether it be physical activity being encouraged or physical education, adaptations of the program to help support the implementation of that, especially related to our Howdy Health programs, can help support those efforts. And then community-based partnerships and organizations, depending on the program topic. And I say program topic, and the program topic doesn't necessarily have to be a risk factor like physical activity in our case, in our examples that we're using. Just a case study example, this past September, we partnered with the Texas A&M University's Counseling and Psychological Services, who wanted to conduct a month-long walk challenge or campaign on suicide awareness and prevention. And suicide prevention involves actively connecting and reaching out to individuals who may be struggling. And so the program design of one of our online physical activity programs connected virtually, encouraged and supported by the team. And so this aligned with their goals, and it aligned with our goals. And so we worked with this group to continue and foster communication with program participants, and provide kind of linkage to needed resources and tools to support someone who may be suffering with or from suicidal thoughts and feelings. And so that was a great example of kind of how a collaboration could come together using a strategic partnership with goals that could align. So if we could go to the next slide there, just looking from a program activities, especially over the past 8-9 months, our program activities have changed a little bit from our traditional local delivery service model that includes face-to-face education. And so navigating to educational experiences that enhances the programs, whether they be classroom or session activities where direct education is provided. And so more recently, that being virtual and having to navigate same issue with same potential barrier as you're navigating to online programs is that technical barrier that may come up. And so working through that and having kind of the local support that's offering these classroom or session activities was something that enhances our current online program offerings. Events, those are a little bit different than educational experiences where there's a certain topic or activity that or lesson plan as part of it. Events can be either in person or virtual with program participants to update on program progress, to share tips from those facilitators. A great example of partners being able to encourage that. And then finally, messaging, especially asynchronous messaging is kind of what I'm thinking here as we're talking about daily posts and interactions that provide a sense of community with program participants. If we can move on to the next one and looking at some examples that some agents shared with me in terms of opportunities as well as lesson learns. One of those, especially if you're implementing an online program, utilize volunteers and program partners and leverage each other's program efforts, again, with mutually beneficial goals. Navigate what those goals are, talk through those in planning sessions, and then develop out content specific to what your particular goals are. In terms of technology tools, one thing that I often recommend as we're transitioning and continue to provide online either education or programs is to use technology tools that you feel comfortable and confident with. And so with navigating all of those tools, in other words, what I'm saying is use a tool really, really well, one tool compared to all the tools available. Another thing that was shared with me in terms of some opportunities and lesson learns is that weekly connections certainly help motivate participants. Social support, as Dr. Hingle mentioned, is so important for sustained behavior change. And so whether that be you facilitating that as a leader in the implementation of an online program, or one of your partners and you're in more of a supportive role, what is that weekly connection, or what is that connection point to provide and further enhance that social support aspect? And then also pre-create content to help spend more time answering specific programmatic questions, especially technical questions, so you could address those so you could proactively prepare for that. And if we could go to the next one, finally, impact. One of the things that we focus on is the effectiveness of our Howdy Health programs. Just in 2020, there are 254 Texas counties. We had 141 Texas counties participate, and almost 30,000 participants registered statewide. We also look at some process questions and some qualitative responses to whether participants benefited from the program, as well as we have some quantifiable assessment pieces through our evaluation components of the program. We also, as Dr. Hingle highlighted, and kind of we also add to the scientific community and have a couple. We just had a recent study published in BMC Public Health confirming the effectiveness of one of our programs, the Walk Across Texas program. And we have another manuscript, which is reinvent with technology-based tools, is another manuscript in development looking at program effectiveness 3 to 9 months post-program, specifically in no and low active participants. And so as you're exploring those online programs available, I highly encourage you to dive into the literature as well, and see and look for those program effectiveness publications. And then finally, if we could go to the last slide, as I'm looking at the time, just to wrap up, I would like to thank our local county extension agents across Texas for their continued support of our particular of the Howdy Health programs offered statewide, and especially those who submitted feedback for this conversation today. I'd like to also thank the other extension faculty involved in the program development, implementation, and evaluation process. And then finally, I'd be remiss if I didn't thank our program partners and participants all across the state. For almost 25 years, have been supported and surrounded by friends, family, coworkers, and thousands of others on our virtual programs, as well as virtual journeys across Texas and beyond. So above, I'll close this portion with a quote to lead into our dialogue that I've been sharing with a lot of recent presentations. Above everything quantifiable, and I won't read this quote word for word or verbatim, but at the end of the day, a testimonial like this as it relates to online programs, and as we go through kind of that scientific backing of the acceptability, efficacy, effectiveness, and finally the adoption, as we're looking at online programs in practice and getting case study examples or testimonials like this, it just goes to show the benefit of not only on an individual level, that our work and your work as a health service provider, public health practitioner, student, individual, what have you, that we could all navigate and help people find evidence-based and important tools to address and promote healthy lifestyles. So I will close with that, and we could open up for some dialogue. And we have you on mute, I think, unless it's on mine.
Thank you. All right, thanks so much. Thank you, Dr. Hingle, and thank you to Mr. Lopez. And now we'll go ahead and take some time for questions. We have a good 12 minutes here. Just a reminder, please be sure to type your questions into the chat box. So while we wait for questions to come in, Dr. Hingle, Mr. Lopez, do you have anything else you'd like to touch on or add that came to mind as you were presenting today?
I could add something. I didn't have a chance to talk about any kind of remote program, so I'm really thrilled that Mike did. And Mike, I think this program looks terrific. I think it's wonderful. So I hope everybody takes advantage of it. I'm involved in 2 different activities right now that involve moving a face-to-face program to remote offerings. And that has been very interesting for a lot of reasons. So that whole adaptation process is an entirely different kind of ballgame than selecting an appropriate app. And I think that the medical field at large, sort of writ large, is struggling with that right now too. You know, there's telemedicine that's worked really well for a lot of people, but also not great sometimes from a connectivity standpoint. So it does bring up a lot of issues when you're transitioning things that have been face-to-face to remote. And so I'm learning a lot. And I guess I'm kind of surprised that we're still at this place where we don't know quite yet how to do that in an efficient way. But on the other hand, it's only been since March that we've really been forced to do that. So I just wanted to make that observation.
Yeah, thank you for sharing that. It is really interesting to see how this transition is happening. And that's actually exactly why we thought this webinar would be so timely. And it does look like we did have a very specific question from Arielle Adams. She was asking, what specific app might inform people if they are engaging in unhealthy eating? For example, if someone is in a huge very calorie deficient, so maybe from both sides of the spectrum, eating too little or maybe eating too much. Do either of you know of those features in an app?
I can answer that or try to. It really depends. Again, there's so many choices out there, but the ones that are good, the quote best apps that are related to helping diet, change your diet, will give you parameters. They won't let people go down into the depths of super calorie restriction or binge sort of as a parameter, but it is up to the person. There's nothing that kind of reaches out from the phone and and gives you an alarm or yells at you. There's certainly reminders built in. I think the most affecting programs are the ones that combine with humans, real humans in the loop. So there's a lot of health coaches out there that are combined with apps. Increasingly in the space of like an FQHC, or federally qualified health center, and so making it more accessible for just like the every person, because all the programs out there that have health coaches built in do cost money. So I do worry about access always for people and equitable access.
Definitely. Okay, and then another question from Angela. How do you work with older generations who have gaps in technology knowledge and skills?
I don't mind starting with that one. And just from our experience, that's a really good question, and that's often one of our one of the largest concerns or potential barriers that our local agents ask us is how to navigate older adults toward the adoption or implementation of online programs. And what we have the advantage, I should say, and just speaking from personal experience, is that our local network of educators or agents to help support and provide help with navigating the online space. Because one of the things that I didn't specifically mention, but it's part of the account creation process for our online programs, which was a pretty big switch for us in 2018 when our when our website launched, was that it required an account creation. And so running into barriers like email, having an email, and then navigating the technical space, given familiarity or unfamiliarity, depending on the intended audience, was something that came up as a concern. And so our educators, we've come up with some best practice solutions to help address that, in terms of providing opportunities to help answer some of those or help navigate some of those technical questions, providing some resources and some frequently asked questions on email creation. Some of the common things that came up with check and spam or filtered emails or things like that were something that really, we actually had a large group of, if I could call out the particular group, Texas retired teachers, who our local staff was able to work with them and really help. And having a rich help desk, I think, helped quite a bit too, because as questions came in, our website applications developer were able to address some of the technical concerns with joining teams or engaging in some of the technical components of the program, which I think gets back to one of the original questions on adoption, and thinking of some of the things that as you're either in the development or partnering with online programs, is some of the things that you may not consider is the maintenance and sustainability of those programs once you're in practice and once you launch, and that there is additional time dedicated towards questions that are more technical in nature versus like myself, more of a content specialist. And so that was something that we've navigated through and working on building out our team, especially from a development standpoint, to help maintain and sustain our programs with the technical side.
Gotcha. Yeah, so being willing to like listen and engage with that population and make changes to make it easier. Are there any apps associated with Howdy Health? If not, are they in the works?
So great question from the audience, and that actually gets to, I think, the first point that you had mentioned as well in terms of, so from that sustainability and maintenance viewpoint, the website is web responsive, which isn't a native app, so not something that you would find in the app store, which does allow us from a cost effectiveness standpoint to be able to maintain and sustain in a more cost efficient manner than having to update in response to OS updates or other things that go along with being a native application. And so that's Dr. Hingle probably has some experience from a smartphone application perspective, but our website is focused on web responsive, with the idea, a long-term goal of being able to develop out a specific native app.
Okay. And can either of you speak to recruiting during COVID? I know that's something a lot of people are probably struggling with.
Difficult to more difficult. I have not had a lot of luck. Maybe I can answer one other question that's sort of further down the line. I see Erica Soltero. Hi, Erica. Good to see you. Asked about considerations in adapting in-person programming for remote delivery. It relates to that question, recruitment, because all of our studies have been turned topsy-turvy with the COVID and the distancing and all the adaptations. So this summer, I just want to give an example. We are working with Native American youth in Arizona from several different tribes and nations, and they have a residential summer camp my colleague has created and led for the last decade or more in northern Arizona. Couldn't meet this summer, and so she pivoted quickly to do what she called Camp in a Box, which was a combination delivery of stuff to people's homes and online activities and remote activities. And so recruitment there was primarily, again, really kind of grassroots through established relationships. A study that we have coming up with the food bank here in Tucson with the Federally Qualified Health Center has been done through providers. So it's still kind of the same methods in a way, but reaching out has been challenging and meeting people where they are because of the connectivity. So, phone calls and things only go so far. It's just really tough. It's been really tough. And the same with delivering programs and education remotely, as a professor at a university, oh boy, that's been a real difficult experience too. So there's no good answer, I guess.
Anything to add to that, Mike?
All right, go ahead. Just to add to that very briefly, one of the things which I saw a question came up running into the same thing with as an instructor at A&M as well, in terms of engagement. One of the things that some of our agents provided as background for this presentation was an expansion of networks. So some of those partners that were not traditional, that it actually helped facilitated that correspondence, albeit virtually, but helped facilitate some of that correspondence with some local groups and partners that they hadn't traditionally reached out to, or were in different spaces than maybe our traditional public health spaces or health-related spaces or professions that we're used to engaging as practitioners. And so just a brief comment on that, kind of an expansion as well as kind of broadening the field and outreach might help support navigation to your online program.
Okay. And someone else is asking if you have any evaluations for technology use among low-income populations specifically.
I don't know, Mike, if you have something. I have an example, but do you have something you want to start with?
You could go ahead.
I can think of one And I was not personally conducting this evaluation, but colleagues in California, the CalFresh program, enrolling SNAP eligible families into nutrition incentive programs, Double Up SNAP, and had some luck really changing the infrastructure, because it had been face-to-face recruitment until COVID by community health workers in certain neighborhoods in the Los Angeles area, San Diego area, and they had to really pivot. And it turns out that their approach of making it easy or reducing barriers to signing people up through a really cool interactive newsletter that they sent out, kind of I think of a PDF, but it has an interactive kind of part to it. So they called it the e-postcard that they sent to people, or people could take use QR codes on their phone to access. And that could be posted again and on walls, but send people to a website that's really easy to navigate. So I think as much as possible, it's reducing barriers. How to make it easy for people to come and find you is the key. So there are some success stories out there, but and again, people with low income in low income categories do have smartphones. They might have limited data plans, and so that might be a barrier, and they might be sharing a cell phone among many family members. So those are considerations.
Okay. Well, it looks like we're running out of time. And again, thank you everyone for attending today's webinar and for the rich discussion. We appreciate you being here. And remember, this webinar will be archived on our website, msdcenter.org. And thanks again for joining us today, and we hope to see you next time.
Thank you.